Thanks.
Okay, good afternoon, everyone. My name is LUBASI SAMBO from HEP Zambia. I'm going to present improving HIV case identification for men using index. Okay, index testing is one of the effective approaches for case identification, especially in Western Province. We identified that the index testing of men was not effective in Western Province. Looking at the data from October 2019 to September 2020, only 27% of men elicited were tested for HIV. So we had to come up with a strategy on how we were going to reach to more men for them to access the services. So working together with WHO, we had to come with a technical assessment package to improve the HIV testing of men through index. So the methodologies used, or the methods used, were focus group discussions, review of data, review of documentation were used to identify the gaps of why men were not accessing the index testing. So the contributing factors to the low index elicitation and testing coverage included the following: inadequate skills amongst health workers to elicit correctly, to elicit contact correctly. And the other factor was the wrong index contact addresses, resulting to failure for community-based volunteers to track all the men that were being elicited. So interventions that were put in place to answer to the gap that was identified. The following were the interventions. ICAP, working together with WHO, we managed to train health workers and also assigned CBVs and daily monitoring of health workers. We realized we were not doing enough in terms of monitoring the CBVs, and also adequate knowledge in terms of indexing was not adequate. And also we strengthened the main clinic services. These were the safe spaces where men would go freely and access the services. They also introduced inter-facilities and inter-district referral system to clients that were elicited, that were outside our catchment area. On top of that, we also introduced WhatsApp platforms where we would share the names of the clients amongst us, the health workers, to test those that were outside our catchment area. Also, ICAP managed to procure phones, which were also supported by giving the facilities talk time, and these phones were distributed in the facilities to be able to contact all the elicited clients that were outside our catchment area. We also trained health workers and CBVs in partner notification. Also, we trained them in IPV. Yeah, so after all that package was given to the facility workers, health workers, and CBVs, these were the results that we achieved. We saw an improved elicitation rate, and also men that were tested from October to September 2021. At least 30,736 men were elicited. Out of this number that were elicited, we managed to test 14,708, which amounted to about 48% of men that were tested. Compared to the other financial year of October 2019 to September 2020, where we saw only 5,212 men were elicited, and out of that, only 1,386 were tested, amounting to about 27% men. So in conclusion, ongoing capacity, targeted ongoing capacity, and the systematic mentorship, supervision of CBVs. I think this is the activities that would need to roll to all the facilities. We need to have targeted trainings to health workers. If we are going to train health workers in activities that do not give us the input, the output that we want, we'll be misplacing our resources. Additionally, strengthen main clinic in all the facilities. I think it's important that we strengthen the main clinic, create a safe space for men to interact freely, to have themselves tested, to have themselves open up to their sexual partners. I think this is something that would need to support in all the facilities. My recommendation, so systematic development, skills development for CBVs. I think we should consider this as very important. We need to give the skills to the CBVs if we are to achieve our goals. Also, we need to invest more in inter-facilities and inter-district referral system, whereby we are able to share the names of those that are outside our catchment area. And also, we need to increase investment in terms of outreach activities. Where we are in Western Province, most of our clients are coming from fish camps, and also some of them are farming blocks. So sometimes it's very difficult for us to reach them, where we need more investments to go towards these activities if we were to have more men brought on book or have more men access the services. My slides ends there, or my presentation ends there. I would want to thank the team from Lusaka head office and from the provincial office in Western Province, not forgetting WPHO in Western Province. Thank you so very much.